Welcome to the Man Cave Podcast with Dan Casper.
Dr. Crow joining us this morning. That sounds better. Technology, man.
Sounds good on my end.
Yeah, there we go. Hey, first off, wanted to say congrats on a wonderful season for your Regis Ramblers. I know tough loss last week, but nonetheless, a congrats on a fantastic season and first year coaching too, right?
Yeah, it was a great year. I mean, it takes a lot of time and effort, certainly, to be on the coaching staff, and you got to give a lot of credit to all the coaches out there across the country that do this because it is a lot, but it's very rewarding, and it was a fun season. We obviously took an undefeated record into that game, and couldn't be more proud of what the guys did. We had a couple of key injuries that really hurt us, but at the end of the day, we tried our best, and the boys left it on the line, so you can't really ask for anything more than that.
Absolutely. So let's get right to it. I want to lead off talking about your quarterback of the future for Minnesota, Austin. I saw the other day he had another knee surgery, another procedure with that knee. Is there any cause of concern that he had to have another procedure, or is this pretty typical, pretty normal kind of thing?
Yeah, so there are some conflicting reports. I did a pretty deep dive on this, given that it's my team.
Right.
So it sounds as though it was an injection, and they said a biologic injection. So almost certainly that means either stem cell or PRP injection. So to answer the first question, is it concerning or is this standard? Yes, it's concerning, and no, it's not standard. So they said it was in response to a little bit of knee swelling with a ramp up in activity. So the concern, I'm sure, is that the meniscus repair is not healing correctly. Now, I can guarantee you they got an MRI before they did anything, and so the MRI probably showed the meniscus looked like it was healing in, and they wanted to kind of throw the kitchen sink at this, so they do a biologic injection. So again, PRP or stem cell, the idea is that's going to stimulate growth factors, which should increase the healing rate in that meniscus tear. There isn't a lot of good, studies that say that's going to be super effective technique, but when you're talking about these kind of guys, doing the extra step is something that they're definitely willing to do. Very low risk to do this, but absolutely gives me concern. It's not something that you want to see, because if everything was going smoothly, they wouldn't do it. So it's definitely not something that's done routinely. So we'll certainly have to keep an eye on how it progresses. But the good news is I think the reports of it being a surgery were incorrect. I think it was just an injection is what it sounds like, and that's less concerning, but still not ideal.
So would that have a lot to do? Because when you with those injections, such, is that again like the cartilage? Because I know we're kind of tarnished with that, but I keep thinking Bakhtiari at that point.
Yeah, I mean that is a possibility, because unfortunately sometimes cartilage injuries do go along with meniscal tears, so that does have to be a potential. But in this situation, I think that's a lot less likely. Isolated meniscal tears and cartilage injuries are not very common to go together. You throw in a ligament injury, now all of a sudden you're talking very common. So you have an ACL, PCL tear, something like that. Cartilage injuries are common, but a standalone meniscus tear like he had makes it unlikely. So I think the odds of it being a cartilage-based injury, and that would be a lot more concerning. You're right. Then you're starting to talk about, okay, is this a knee that we're going to have to be dealing with his entire career? And that's not a situation you want to be in. So there's certainly the hope it's not that. I think it's unlikely to be that.
Gotcha. Dak Prescott, he's right now done for the season after undergoing surgery. As the official phrasing is a partial avulsion of his right hamstring. Was that partial tear, like the hamstring came off the bone a little bit?
Yep. So that's a surgery that I do. So I take care of patients that have that same injury. It's not super common, but we do see it. So when we talk about a hamstring injury, a vast majority of them are going to be a quote pulled hamstring, right? So we've all, well, not all of us, but a lot of us have experienced those. So obviously a lot of pain, tightness, but those injuries are in the muscle or the muscle tendon junction. It is a very different injury when the tendon avulses or tears right off the bone. In that situation, it doesn't heal correctly, or at least not always. So depending on the extent of just kind of get through without surgery, but unfortunately sometimes you do have to go in and fix it. And certainly an athlete like this that requires, explosive movements and peak performance, partial tear may be something that you're worried about not healing correctly, so then they'll go in and fix that. So what you do is you go down to what's called the sit bone, so the ischial tuberosity, so that's the bone that's like the knob of your butt, if you will. That's where that hamstring originates. You go in, you put an anchor or two in the bone, you grab the tendon, pull it back up. It's kind of a prolonged recovery, so he'll be on crutches for probably 4 to 6 weeks. Ramp up activity from there, but a good 5-6 months till he's doing any real vigorous activity. So it's a pretty long recovery. clearly, of course, this season is done. But I do think the prognosis is good. The majority of patients that have this surgery are pretty happy with how it turns out in the long run.
Is that too why that maybe they took a long time for them to decide if he was going to have surgery or not because of the possibility of rehab?
Yeah, for sure. So, I mean, with these partials, partial can mean anywhere from 1% to 99% torn, right? Both those are considered, quote, partial. So if you look at it, that there's a lot of factors that go into play. I mean, certainly, again, who you're talking about. Sometimes we get a referral from someone like, a 75-year-old person who, their highest level of activity is playing shuffleboard. I mean, that person's never going to put the demands in the body of like, oh, yeah, you're an NFL quarterback. So you have to look at what the patient's trying to do. And so even a smaller tear can be a lot bigger deal in someone who's going to push their bodies to that edge. So in his case, I'm guessing it was symptomatic enough that clearly it was bothering him, number one. Number two, there was clear, signs of partial tears in the MRI. And three, he probably didn't progress with their initial round of some treatments. And they said, okay, it's time to pull the trigger and get it fixed.
Interesting. Staying with the quarterbacks, Trevor Lawrence sounds like he's going to miss another game, and they're calling it a AC sprain, but it's in his non-throwing shoulder, Austin. Is that unusual for, I feel like if it's not in his throwing shoulder, have we seen quarterbacks play with that, or is it a pretty dangerous injury to play where another hit could mean, some I guess, a more severe injury?
Yeah. When you look at the situation, it is a very safe injury to play with. So grade 1 and grade 2 AC separations, which is what this likely is, those are very safe to play. Now, they're also very painful to play with. And so often with those ones, we basically test it out and be like, all right, how do you feel? And sometimes it's bad enough where they can't even fully move the arm. So if you don't have full range of motion, full strength, we generally will not allow an athlete back on the field. So he may be to the point where it's like, look, this just hurts so bad I just can't use it. And it's his non-throwing arm, which he won't use as much, but you still use that arm, right, in a lot of different things in the quarterback position. So my guess is it's a situation where it's not so much they're worried about him damaging it further. It's the fact that he probably has enough pain and dysfunction that he's not able to play. It's been, this will be his second week? Because I know he missed
second week, yeah.
Did he miss the game before the second week? So
yeah.
I would bet he'll be back pretty quickly. That is one joint you can consider injecting and numbing and getting people back out there, but people, of course, are a little hesitant on that. But it's one of those things. I mean, he's obviously going to be the future of that franchise, so they don't want to risk that. So my guess is he'll be back in a week or two, and their season's already in trouble, I guess we can put it that way.
Yeah.
So they're probably not interested. I mean, if they were in the middle of a playoff run, they might be more inclined to push that envelope. But in this situation, I think they look at the big picture and say, all right, heal up. Let's get you back when you're ready.
I know this was a couple weeks ago, but it's first I've got to ask you about this because we were speculating on what it was when it was going on, but found out Ohtani had a labrum surgery to repair that. What's kind of like a typical recovery time? And is that a type of injury where you were surprised maybe that he still tried to go out there and swing a bat with a torn labrum?
It depends. I mean, so labral tears, just a quick anatomy review. If you talk about the socket or the glenoid of the shoulder, it's surrounded by a fibrocartilage rim. That's the labrum. It provides several different functions. One of them is stability of the shoulder. So when you have a tear in the labrum, it allows the shoulder to slip out of place. And his tear was probably in what we call the anterior-inferior quadrant, which allows the shoulder to slide forward and down, which is by far the most common way that the shoulder comes out of the socket. And certainly his mechanism, that's almost certainly what it was. So we actually do keep a lot of athletes on the field trying to play through those, knowing that there's going to be limitations. So I'm not overly shocked he was able to play with it, understanding that it obviously wasn't 100%, especially given the context of where he was playing, right, in the World Series. But it also doesn't surprise me that he had surgery on it. So we unfortunately have to take care of a lot of athletes like that. So there's a number of different factors that come into play: size of the tear, location of the tear, associated injury. So is it just labrum? Is it labrum with cartilage? Is there any bony involvement? Is there bony involvement in the ball side? So it's called a Hill-Sachs lesion. Those are all factors that come into play when we decide whether or not it needs surgery. And again, the basically what you're looking for that athlete to get back to, he's the peak of the peak, right? So you're going to want to make sure he gets back. Now, as far as recovery time, that actually has a pretty good recovery timeline. So we're often able to get athletes back to full go in around 5 months. So that's considering some other surgeries in the body that take a full year plus to recover. He should be back around that 5 to 6 month mark doing most activities. So it'll be about 6 weeks in a sling, another 6 weeks in a heavy lifting, transition ramp back up. Month 3, 4, 5 is let's get you back to playing condition, and then hopefully go from there. So he should be back by the beginning of next season. Now, again, given who he is, Maybe they'll slow play that a little bit, but I expect a full recovery and one that's quite predictable.
Interesting. I want to ask you a couple of hoops injuries here. One, going to the Bucks here. So we're waiting for Chris Middleton to return, and I know he's a guy that's been banged up with injuries, especially the last few years. This offseason, he had surgery on both of his ankles. And then even preseason, we listened to Doc Rivers, and he kind of threw out some possibilities that we were going to see him in the final preseason game, and kind of gave the impression like, oh, he's going to be close to return. He has yet to play, and he has yet to do a lot of 5-on-5 stuff, if any at all. And Doc has been very, kind of like not revealing like a lot of coaches are. But and he was asked, is there a setback? Is it kind of at a pause? And he didn't really answer that. The fact that he's had two surgeries on his ankles this offseason, and when there was some maybe positivity that he was going to play in the preseason, and we're already in the middle of November, we haven't seen him. Would you think that maybe there was a little bit of a setback that we don't know about?
I would say potentially. It's not 100% clear what he had done. So we knew it was related to ankle instability, which suggests he probably had what's called a Brostrom procedure, where we tighten up the lateral ligaments. But I also heard some reports that sounds like it was more of a kind of a cleanup situation.
Mm-hmm.
In either event, the fact that he's, there's been this timeline to try return and he keeps not hitting those numbers, that is concerning always, right? When you have a goal of like, all right, we're going to try to get back at this time point, the only reason you don't is something comes up. Now, it could be something little like, the ankles are a little swollen and sore. Not a huge deal. If you're saying, look, I still feel instability, that's a big concern. So it really depends on what's holding him back. If it's minor, not as big a deal. If it's serious stuff, this could be a bigger setback. We're worried about, potential long-term ramifications as far as like ever getting back. I mean, if he has ankles that he's not able to get back and play, and then of course, the dreaded cartilage injury, and that unfortunately does happen fairly commonly with ankle instability. So if he's dealing with a cartilage injury now, that really complicates the matter, and then you're definitely talking about career threatening. So of course that's extrapolating. That's not been stated in the public. I've not seen any reports of that, but when you start seeing these delays, it raises your eyebrows and say, wait a minute, is there something more going on here?
I got to ask you about Chet Holmgren's injury, just because I've never heard something like this when it comes to a hip injury. But it says that he suffered a right iliac wing fracture in his hip. What the heck is that?
So it's the wings, those things that flap and you fly with? No.
That's what is confusing.
No. So your iliac wing, so if you feel the side of your own hip, that the rim, like the hip pointer,
mm-hmm.
that's your iliac wing. So the ilium is the pelvic bone. Your pelvis is made up of 3 bones, 3 on each side. The ilium is the big wing along the top, so that what you feel kind of above the actual hip joint. And so he landed right on that. It's a large area, great vascularity, great ability to heal, almost certainly will never need surgery. But because so many muscles originate from that area, it's very, very painful. So when people break that, I mean, they're shut down for a while. So I don't anticipate he'll be back anytime soon. I know they've kind of thrown out 6 to 8 weeks. I'd be surprised if he's back right at that time point, because he's going to have a hard time walking for a while. I mean, this is a very painful injury. But like I said, prognosis long-term is excellent. It'll heal, but it's going to be one that's going to limit him for a while. And, obviously he's had now 2 big injuries. He had the Liz Frank injury in his foot.
Mm-hmm.
That was season-ending. He did play all of last year, didn't miss any games, but now this year, I mean, you look at him, he's the kind of guy you could say, hey, maybe we should pack a couple pounds on his frame, but would that have helped him here? Maybe, maybe not. But it's certainly an atypical injury. I mean, pelvic injuries in athletes are rare, not unheard of, but rare. But this is one that certainly is going to hold him out for a while.
All right, before I let you go, and I'm only asking you this because I want this sport to get back up to when we were younger and such. Paul or Tyson tonight? Who you going with, Doc?
I mean, I was raised on Mike Tyson's Punch Out on Nintendo, so I mean, I gotta go OG on this. I don't know. I mean, it's just crazy. He's 58 years old.
Mm-hmm.
I mean, it's crazy they're allowing this fight to happen. I mean, I'll watch it. I guess I'll be a sucker who will watch it. But I hope Tyson wins. But boy, it's just unreal. He's at that age out there, but he looked pretty good. I mean, he looks like he's in pretty good shape. So do I think he's going to win? No. Do I hope he's going to win? Yes.
I'm the same way. I want him to win, and I think a lot of it is just the nostalgia. I just want it. First of all, I want boxing to get back to when we were younger, right? Like the Evander Holyfields and Tysons and all that. So I'm putting too much hope into this. because I want Tyson to just
I
go out
think
there
we're
and
in the
dominate.
same camp there.
Yep.
I think we're in the same camp there. I think it just, MMA is kind of cut into that niche a little bit, so I don't know if boxing will ever be what it was. But, yeah, I mean, we grew up with the Holyfields, the Tysons. I mean, there was some pretty good boxing back then. I remember watching fights, and, it'll be hard to say if that ever gets back to that.
I agree. All right, Doctor, we appreciate it as always, man. Enjoy the weekend, and we'll catch up with you again soon, okay, bud?
Sounds good. Take care.
You got it. Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine.